You know, when we think of malaria, our minds usually jump to things like fever, chills, mosquito nets. But the real story, the one that often makes the difference between life and death, it's not just about those symptoms. It's about a hidden, targeted assault on one of our body's most vital organs.
Just to give you a sense of the scale here, malaria is a massive global crisis. We are talking about over 200 million cases across the world every single year. I mean, just let that number sink in for a second. And tragically, a huge number of those cases end in death. Around 600,000 people die from malaria each year. That makes it one of the deadliest infectious diseases on the entire planet.
But like I said, the story doesn't stop with the symptoms we all know. For so many people, the real fight for survival is happening silently, deep inside the body's super sophisticated filtration system.
And this is where that hidden danger really comes into focus. In cases of severe malaria, the kind caused by the most dangerous parasite, a shocking 60% of adult patients develop what's called acute kidney injury, or AKI. Now, this isn't just some rare side effect. It's a common and often overlooked part of what makes this disease so deadly.
So, to really understand why this happens, we first have to get to know the attacker. Because you see, not all malaria is the same. The parasites themselves are actually quite different.
On this slide, you can see the two main culprits when it comes to kidney issues. On the right, you've got Plasmodium malariae. It's kind of slow, a bit more picky. It only likes to infect aging red blood cells. But on the left, that's the true aggressor, Plasmodium falciparum. This one is totally indiscriminate. It invades red blood cells of all ages, which leads to this explosive, overwhelming infection that can bring the body to a crisis point fast. Which, of course, brings us to the big question, right? How on earth does a microscopic invader floating around in our bloodstream manage to bring a complex, powerful organ like the kidney to its knees?
Well, it turns out P. falciparum doesn't just attack in one way. It launches this devastating two-pronged assault on the kidneys. It's a combination of a direct blockage and a nasty toxic chain reaction.
So the first part of the attack is a mechanical problem. It's called cytoadherence. Basically, the infected red blood cells grow these little knobs that make them super sticky. They start clinging to the inner walls of the tiny blood vessels in the kidneys, creating these microscopic traffic jams that just choke off the blood supply. And the result of those tiny traffic jams is pretty predictable, and it's devastating. The kidney tissue gets starved of oxygen and vital nutrients. This direct physical damage is called ischemic injury, and it's actually part of the parasite's sneaky strategy to hide from your immune system.
But the blockage, that's only half the story. The second prong of this assault is a chemical one. It's a toxic chain reaction that gets triggered by the parasite's destructive life cycle inside our own red blood cells.
Okay, so as P. falciparum multiplies, it causes this massive destruction of red blood cells. This releases a flood of hemoglobin into the blood. Now here's the problem. When hemoglobin breaks down, it unleashes this really toxic substance called heme. The kidneys, they go into overdrive trying to filter out this poison, but they just get overwhelmed. The heme itself is poisonous to the kidney cells directly, and to make everything worse, it starts clumping together, forming these solid casts that literally clog up the kidney's internal plumbing from the inside out.
And look, don't just take my word for it. The science completely backs this up. Research confirms this is a two-part attack: cytotoxicity, which is the heme directly poisoning the cells, and intraluminal cast formation, which is just a fancy way of saying that sludge is physically clogging up the works. It's a brutal and incredibly effective combination.
So, we've seen the battle on a microscopic level. Now, let's pull back and look at how this all shows up in an actual patient. What are the warning signs doctors on the front lines are desperately looking for? Well, doctors have a sort of checklist of red flags. A really high parasite count in the blood. That's the most obvious one. But they also look for things like jaundice, that yellowing of the skin and eyes, which tells them the liver is stressed and tons of red blood cells are being destroyed. They also check for other blood markers, like low platelets and severe anemia. All of these are signals that the body is being totally overwhelmed and the kidneys are at extreme risk.
When these signs start to appear, the medical response has to be incredibly fast and aggressive. Fighting back against malarial kidney injury is an absolute race against time.
So, the first step is to hit the parasite and hit it hard with the most effective anti-malarial drug out there, which right now is artesunate. But that's not enough. To save the patient, you have to support the failing kidneys. This often means starting dialysis early and doing it frequently to do the job the kidneys just can't do anymore. And in some really extreme cases,
Blood transfusions are even used to help lower the parasite load.
But even with all of these powerful treatments, the prognosis can be really grim. As you can see here, the mortality rate from malarial AKI can be as high as 50%. I mean, it's a huge range from 10 to 50%. And where a patient falls on that spectrum depends almost entirely on how quickly they can get the right medical care.
And you know, for the people who do survive this acute crisis, the war might not actually be over. The damage can be permanent. Research is now showing that up to 7% of survivors go on to develop chronic kidney disease, a lifelong condition that requires constant care.
So, if there is one thing to take away from all of this, it has to be that malaria is so much more than just a fever. It's a full-body systemic assault, and as we've just seen, the kidneys are very often a primary target.
And this really leaves us with a final and critical question for the future. As modern medicine gets better and better at saving people from acute malaria, we're going to have more survivors. So what new public health challenges are we going to face in managing the long-term, chronic damage this disease leaves behind in its wake?